Difference between non-Hodgkin's disease and Hodgkin's disease. The lymphomas are liquid tumors because it affects the lymphatic system. So here the definition we can see first. It's a type of cancer in which there is monoclonal proliferation of B or T lymphocytes. Non-Hodgkin's mainly due to the proliferation of B or T lymphocytes. But in Hodgkin's disease, here there will be lymph malignancy of proliferating germinal central cells. The germinal central cells of lymph, it will be affected. That's why it is lymph malignancy. And there will be proliferating germinal center cells. The distribution of the disease, the non-Hodgkin's mainly non-contagious lymph node spread. It affects only by lymph node. It is non-contagious lymph node spread. Hodgkin's disease, it is contagious lymph spread. Histology may be varies because it affects both B or T lymphocytes. That's why histology may vary. But in case of Hodgkin's disease, there will be always the presence of Reed-Sternberg cells in Hodgkin's disease, and it is very important. Reed-Sternberg cells always seen in Hodgkin's disease, and it may ask for your PSCs. Then history, not history, it's clinical features. Okay, the clinical features mainly painless adenopathy. There will be lymph adenopathy will be present. Mostly it will be painless. That's why most of the persons will not be notice this condition. Okay, and there will be B symptoms. That also very important. B symptoms common. Here the fever will be more than 38.5 degrees Celsius. The person will show the night sweats. Most of the person, 10% of the person will have the weight loss. So the B symptoms, somebody may ask what is B symptoms. So B symptoms is nothing but there will be fever, there will be night sweats, there will be weight loss for 6 months. Within 6 months, there will be weight loss. So, these are the symptoms of non-Hodgkin's disease. Same like non-Hodgkin's disease, Hodgkin's lymphoma also there will be B symptoms, but there will be extra symptom is pruritus. There will be extra symptom of pruritus in Hodgkin's disease. Next, incidence. Incidence rate is increasing. Hodgkin's disease incidence rate is stable, and age increasing incidence with the age. If the age increases, there is the increased chance of incidence of non-Hodgkin's lymphoma. But in Hodgkin's disease, it occurs in 29 years of age, median 29 years of age it affects. Next, regarding the site of lymphoma. In case of non-Hodgkin's lymphoma, the site always in the lymph nodes that will be anywhere in the body. It will be in the lymph nodes anywhere in the body. In case of Hodgkin's lymphoma, it typically begins in the upper body such as armpit, chest and neck. So the site usually Hodgkin's, it starts from the upper body, but non-Hodgkin's it may occurs anywhere in the body. Then diagnosis, non-Hodgkin's disease is typically not diagnosed until it has reached more advanced stage. In the clinical features, we already said that mostly it's lymphadenopathy, it will not be noticed. It is painless, so it will not be noticed by the patient. So mostly in the aggressive stage, it will be noticeable. So that's why there may be a chance for decreased or it will not be noticed. So that's why it will not be found out. Hodgkin's lymphoma disease is often diagnosed at an early age. So, because it appear in the upper area of body, so it will be noticeable. Then prognosis, highly variable type in case of non-Hodgkin's, and the curable rate is very low. In case of Hodgkin's, most of the cases will be curable. 70 to 80% of the cases will be curable. The treatment usually the radiation and chemotherapy for non-Hodgkin's lymphoma. In case of Hodgkin's lymphoma, mostly the radiation for localized treatment. In case of widespread or advanced disease, we are using the chemotherapy. So mostly when we are saying about the lymphomas, chemotherapy is useful, okay, because it is liquid, it affects the liquid cancer, okay, it is a liquid cancer. That's why chemotherapy is mostly useful for the lymphomas. But in case of localized, we can use the radiation, okay. So this is regarding the difference between non-Hodgkin's and Hodgkin's. Thank you.